my name is Domingo Solomon. I'm a physician assistant at TaylorMade Diagnostics, and I'm going to discuss diagnostic testing and its importance of surveilling employees. Essentially, we have several ways to survey a patient, and they consist of blood work, pulmonary function tests, hearing tests, and even x-rays, just to name a few. And these are basically used to establish a baseline profile of the patient who is entering or returning to a career where he or she may be exposed to hazardous material or environment. The initial battery of tests establishes a worker's current state of health and allows providers, such as myself, to compare future diagnostic testing with the initially performed battery of tests. It is always worth noting that some of these employees do come into a new field, and they may not come in with pristine diagnostic studies, and these studies may indicate that they may have been exposed to a former work site. Additionally, these testing can also screen for known and unknown medical conditions that may warrant further investigation and or referral to their primary care provider. Patients will continue this monitoring process, and they will have periodic testing to establish whether there is a difference between their baseline and what they have now. Stable patients will obviously continue the routine monitoring. However, any patients that have any aberrant findings may be suggestive that there is a contaminant or chronic exposure, and if these do exceed a threshold set by OSHA, then this will prompt us to go ahead and report to a company and the employee as well by their request. Medical providers will then make recommendations to the employer to remedy the control measures of the environment or the patient's protective equipment, or remove the patient from the suspected source of the contaminant.